Come on, PowerPoint, let's get it together. Here we are. So again, welcome. I work for Peer Health Exchange. When today we're going to talk about how powerful it is for near peers to drive impact in health education and real health outcomes in young people. So again, who am I? This is me in this lovely headshot. My name is Evan Joy McLaurin. My pronouns are she, her, hers. Again, I'm the manager of business development. I went to Spelman College for undergrad, and then I went straight on to grad school at Brandeis University, where I got my MBA, focusing in nonprofit and mission-driven organizations, and Master of Public Policy, where I focused in sex education policy. And a fun fact about myself is that health class was my favorite class. I'm still very close with my health teacher, and she was actually a reader in my public policy capstone. And Chrissy?
Hello, everyone. Sorry for being a couple minutes late. My name is Chrissy Leahy, her, she pronouns. I'm Director of Partnerships here at Peer Health Exchange. My undergrad was at Occidental College in Los Angeles, as well as my master's in public health was from UCLA. And a fun fact about me, when I saw Evan's response, it made me think about something. I love sexual health education as well. And I really enjoyed a partnership that I had with the UCLA Sex Squad, where we worked with young people and rewrote songs and did performative arts-based stuff for health education. And I really enjoy rewriting songs, such as like an Usher song one time, remixing You Don't Have to Call, and putting in like fun sexual health information and knowledge in it.
Oh my gosh, Chrissy, that's my favorite Usher song ever. That's so funny. Are the slides not advancing for everyone else? I see that in the chat box, the slide hasn't advanced. So the slide hasn't advanced for you. Did it just advance now? No, PowerPoint, what is going on? Okay, hold on. I'm gonna try again. Let's try again. Did it just change now? Yes, I can figure things out. Awesome. Okay, so first of all, so what is the mission of Peer Health Exchange? So Peer Health Exchange has been around since 2003, and our mission is to empower young people with the skills, knowledge, and resources to make healthy decisions. And that includes health-seeking behavior, being able to identify mental health resources, knowing different methods of contraception and one knows what works for them, knowledge about substance abuse, abusive relationships and things like that, and being able to make healthy decisions at a young age. We do this by training college students to facilitate skills-based health curriculum in under-resourced high schools around the country. So really what that means is we train college students to be near peers, is what we call them, and teach health classes to schools that otherwise cannot afford a robust health curriculum. We've talked to a lot of our students, and what's really unique about our program is that students find it so much more, they're so much more engaged, and they're so much more like ready to receive information from students who are college age, who are really interested in the subject matter, rather than PE teachers who are being forced to teach a health class and they're very uncomfortable and they sing things like, you know, don't have sex or you'll die. Shout out to Mean Girls. But yeah, so we found, and then the students find that the health facilitators find that they are much ready, like since they're closer in age, they can communicate and, you know, have better conversation and rapport with the students as well. So before we get started, instead of a peer share, I would love for people to share out on this call. Feel free, you can either say it in the chat or get off mute and say it, but what do you wish that you knew about your health when you were 14 years old? So what Peer Health Exchange does, we usually teach workshops in 9th grade, so around 14 years old. So what was missing from your health curriculum when you were in 9th grade? What do you wish that you had known? So feel free to put it in the chat box or unmute yourself. Take some time to think.
At 14, I wish I had known more about my menstrual cycle and just like the stigma had been lifted from that. And I just remember all my friends and I, we were on our periods and we were in high school and we just felt very uncomfortable with our own selves, and honestly didn't know anything about what was even happening. So I wish I had known more about my menstrual cycle when I was 14 to feel less like odd as a person.
Yeah, feeling validated and, you know, understanding that your experience is normal and something you're going to experience for the rest of your, for a very long time in your life is definitely something that's validating, because, you know, 14-year-olds often already are trying so hard to fit in. So like any information that, you know, helps 14-year-olds feel more empowered in who they are encourages health-seeking behavior and confidence in that. Let's see, in the chat box, people are saying what a healthy relationship looks like. Yes, definitely. Healthy masculinity, right? There are many examples of non-toxic masculinity that could be included and are thus included in our curriculum. I wish I would have known that my body would change over time, right? Like life happens, okay? My body does not look like it was when I was 19, and I'm like thankful for it, and it grows and it's beautiful and I love it. So people need it. I wish I knew that at 14 too. Let's see, my school taught abstinence only and never taught consent. As you can imagine, a lot of my peers got pregnant really young, and the way they taught about periods also created a lot of shame. Like, you should hide your feminine products. Right, like why would I have to hide something that I need to use? It's like a Kleenex. Sex ed that includes different sexual experiences. Yes, we found that a lot of sex education programs are so heteronormative, and as if that non-heteronormative people don't need sex education and protection too, which is like clearly 100% not true. And you know, when you teach about non-heteronormative sexual behavior in the classroom, it of course, you know, strengthens and empowers people's experiences to again seek, you know, resources that they may need. So thank you, people, for sharing. Anyone else have something that they want to share about ninth grade? Maybe a funny story.
I can go real quick.
Ooh.
Yeah. So my high school also had abstinence only education, so they didn't teach us like anything about birth control or how it works. So we had also a lot of like students who got pregnant very young. And something that I wish they would have talked about more is like what a like sexual health like medical exam looks like. They didn't teach anybody anything about like, you know, what it's like to go into the doctor when you have an issue like that. And so I feel like that's something that should be really important to like prepare yourself for and like know how to work through.
Exactly, because new things can be, of course, are inherently scary. So if you, in a good health class, when you're talking about, okay, so this is what your experience, this is who you need to talk to. Some of my favorite parts about Peer Health Exchange is that they do health center visits where, you know, the class will actually go there. So sometimes, you know, when you go with a group, it's a little less, you know, daunting. So you're not going somewhere the first time. So it lets people know about their resources that are available to them, which would have been very helpful when I was also in ninth grade. Thanks everyone for sharing. I really appreciate it. So yeah, so what do we do? Why are we doing this? Like a lot of you said, there are certain areas that have really high teen pregnancy rates that often, you know, facilitate early dropout rates for high school students. And we really want students, of course, to be able to finish school with the knowledge and health that they need in order to do that. You know, a lot of 1 in 10 high school students have reported experiencing violence in a relationship that, of course, affects school, but also their livelihood and overall health as well. You know, 3 in 10 high school students report feeling sad or hopeless. We know depression rates are really, really high. So we want to make sure, I know when you are depressed, it's really hard to like ask for help, but you know, at least because of Peer Health Exchange, person who may feel those things may be at least aware of where the health resources are and, you know, be more likely to access them. And of course, like you all are talking about with abstinence only, a lot of these states do not require, the states in orange in this slide do not require comprehensive health education. There are a lot of states that are still abstinence only. There are a lot of states that, you know, do not have to teach about consent, even at this day and age. So we're really working to make sure that as many young people have access to comprehensive health education as possible.
Ms. McLaurin, may I ask you a question about the last slide?
Yes.
I have 2 questions. One, is this self-reported survey data? And 2, I want to know your opinion. I was reading a statistic the other day that there's a 400% increase in antidepressants, of issuing of antidepressants in the past 20 years. And do you think that there are actually 400% more students with mental health, or 400% more students who are actually reporting it instead of toughing it out? And I'm wondering how to go about reading these statistics, especially the ones about high school. Just being in high school 3 years ago, these seem insignificant.
So first of all, to answer your first question, this data comes from YRBS data. So there's a survey that that different districts do that have these specific resources, and I can forward that to you after if you want to see them, because they're actually it was really enlightening to me. While these, I'm not familiar with the 400% report, but I do think that in this day and age right now, I think mental health has become something that's more talked about that wasn't talked about before. So I don't think that, like, you know, depression is a brand new thing or sadness is a brand new thing, but I think a lot of people are more encouraged to talk about it. So that might be a big indicator and reason why certain, you know, people are accessing new resources. Again, peer health exchange isn't really, you know, in none of our curriculum are we saying that, you know, you need to go beyond antidepressants. We're just saying, we just make sure that you are able and aware of accessing, you know, the school health center, like the school health counselor. And we make sure that in our workshops, we make sure that we list off the people in the school and people in the school community, as well as outside the school, that students can talk to, not necessarily for the purposes of, you know, receiving a prescription, but, you know, just making sure that they know where those resources are.
Thank you for answering.
No, thank you for that question. It's very interesting to think about. So yeah, some of the questions that we get from their students are similar ones that you guys brought up and things that you wish you know. Like, what are some symptoms of STIs? How does an internal condom work? What even is sex exactly? A lot of the young kids ask, like, what's the average penis size? So, you know, we were talking earlier about women being aware of their menstrual cycle and, like, knowing that everything's normal. A lot of young boys and, you know, young people with penises want to know, like, are they normal? Looking at their bodies and how they're changing. And, you know, a lot of just ninth graders want to feel like, oh, okay, I'm not, like, weird or different. Like, this is a normal thing and my body's going through these crazy changes, but, like, it's okay. And everyone's body changes at their own time. And of course, like, how does an IUD work? That is something I wanted to know in ninth grade because it just didn't make sense to me at the time, but now I know. So right now, so how have we reached people so far? So far, we've reached people in 9 different cities, in San Francisco, New York, LA, Chicago, Boston, Denver, Dallas, and Detroit, and we're counting. We're growing in new cities every day. We've trained over 8,500 young health educators, which are those college students and near peers, to reach over 150,000 young people throughout the country since we started in 2003. So an example, like we said, we're already established as a Bonner server site at Wagner College in New York, and we know that Bonner has very specific hour requirements. So we make sure that I've met with Bonner program leads at different schools and make sure that the students who are involved in Bonner and want to do PHE, Peer Health Exchange as a Service site, that we meet that requirement. And sometimes that requirement looks like teaching the health classroom, teaching, you know, the classic facilitating health workshops in the 9th grade classrooms, but it also sometimes looks like organizing on campus for health exchange, for, you know, different health workshops as well. Because of course, I went to college myself, I always thought that college students definitely need health workshops as well. And sometimes it also increases interest in volunteers or working for Peer Health Exchange. So yeah, so what is the impact that Peer Health Exchange actually has? Peer Health Exchange, people are 20% more likely to accurately define what consent is. They're more likely to, you know, use health centers and access those local resources and talk about concerns with a trusted adult, as they're able to know what adults they can trust. They are able to, you know, use the school-based health centers that are local to them. A lot of schools do have school-based health centers, but some students have like never seen it before, never been inside. Peer Health Exchange definitely works to try to increase that for students who need it. Oh yes, I'm more than happy to share this PowerPoint with you all. Okay, so why would you want to become a health educator? All the others for obvious reasons and like help all these youths, but why would you want to be one? So there's a video that's supposed to, well, 1 second, sorry. I don't know why the video is not working, but I'll come back to it. Maybe Chrissy, if you could try to load it and then I could share it. So there's a cool video of his wife who we'll show later. So peer health education benefits. So yes, of course, we benefit the 9th graders and the people that we're helping, but it also benefits the college students as well. You strengthen your public speaking skills and facilitating skills and your network, so you get to know people who are at those local health centers and build your, you know, your standing in the community. So also, of course, a lot of students, you know, leave college and sometimes think that they want to teach. So Peer Health Exchange also offers that first opportunity in saying like, oh, do I want to teach in front of a classroom? Do I like kids? Do I want to talk about stuff like this? So it's a nice early intro. And of course, Peer Health Exchange has different types of roles. You can be the chapter director, and a lot of times Bonner students, since they do have that service hour requirement per week, they do often take leadership roles within the college Peer Health Exchange chapter, where they are leading, you know, facilitating the training, like help with their trainings and help, you know, with the scheduling and where students are, like what workshops are happening when and at what schools, but also, of course, you could just be a health educator, which each commitment has different hours per week. And so what do you really need to be a peer health educator? You do definitely need the time, but Bonner definitely facilitates that. You need to feel dedicated to the success and health success of young people. And we definitely need cultural humility. We definitely want people who, of course, are very accepting and open to different types of people. We definitely want people who are able to identify with the students that they serve. We work really hard to try to get our chapters to match the demographics of the people that they help. Of course, facilitating that near peer connection, commitment and accountability. You can't just not show up for a workshop one day because then the kids aren't going to get health classes. But in those health classes, it's definitely 2 people per class, so you're not usually in that class alone. And definitely commitment to personal growth and social impact. And after that, I'm going to pass it off to Chrissy, but what does Peer Health Exchange look like in this virtual world right we're in? Because it's not like we're going into classrooms at this moment and facilitating health education classes because schools are closed and COVID. So we are developing a virtual platform where students are able to ask questions, and we're releasing videos and providing different resources for students to be able to access health information in a virtual world. Chrissy, do you want to add anything?
So we're doing that through a variety of different ways in terms of how Eb and Joy shared in terms of with our virtual platform, and especially utilizing social media, YouTube videos, doing IG live conversations where it's actually health educators that lead topics that they're interested in, whether that's like directly related to health in terms of as Kayla in this photo, she's one of our health educators. She shares about how to set boundaries with social media, just in terms of like how social media can also impact our health and our mental health and just our feelings about ourselves sometimes. So doing really like relevant stories that young people connect to. And in addition, what's really exciting for next year is thinking about how we can still stay connected, even as we're like doing right now on this call right now. In Dallas and also in Detroit and Chicago, we've actually been testing out virtual workshops that are really tailored to the times that we're living in right now in terms of talking about mental health, how to cope when like everything's been disrupted from just your like personal daily routine to going to school or going to work. So health educators from Dallas and Detroit have been also like co-designing and working with PHE staff to create some of these new workshops, and allowing us to think as an organization, like, yes, we can still collaborate with health educators, even though they're not going into the classroom. We can still connect through virtual platforms like Zoom or it's mainly been Google Hangouts, to be able to stay connected to high school age students, which is really exciting and something we're investigating, figuring out how to do it for next year.
And with that, Chrissy, do you want to share the video? I can stop sharing now.
Yes.
Okay, thank you so much.
Of course. And this video is, it's really exciting. It was made from our health educators that are in Los Angeles and sharing about how they're working together with Peer Health Exchange. Peer Health Exchange as health educators to build a world, essentially.
Is the volume on, Chrissy? I can't hear it. Can you hear it?
Okay. Sorry, let me reshare again just in case I didn't hit share with my audio. Stop share. Share screen. Can you hear the audio? I can hear it. Can you hear it? Can you hear my audio?
It says it's not playing, no.
I don't know what to do.
On share screen, hold on. When
What
you
is-
go, if you press it, it'll give you the option for advanced. And then in that, there's a box that says like share computer or audio. It's the one in the middle. Click that one, and that should let you.
Because when I was trying to find that when I started sharing the screen. Oh, perfect. Okay, now I see it. Sorry about that. I forgot it was there. Okay. Apologies. Okay. Now can you hear it?
I'm building a world.
I'm building a world.
I'm building a world.
A different world where it doesn't matter what I look like
Or where I was born. Or how much my parents earn.
In my world, I have the knowledge,
The skills. The resources.
and the power to make the best possible choices.
About my health.
About my health. About our health.
Between 2001 and 2017, the suicide rate for Black girls doubled.
And rose 60% for Black boys.
Today, 1 in 10 Latinas attempt suicide.
1 in 3 adolescents end up in abusive relationships.
And 21% of trans, genderqueer, and non-conforming college students
Experience sexual assault.
Nearly half of all new STIs occur in young people.
But only 54% of teens use condoms.
1 in 7 high schoolers use opioids.
Today, 1 million high school students drop out every year.
But in my world, college students
like me are trained to lead high school students
Like me.
through direct conversation
about mental health,
sexual health,
and substance abuse, equipping all of us with the knowledge,
skills,
and resources
to make the best decisions for our health.
Across the country, Peer Health Exchange trains college students to teach a skills-based health education curriculum to thousands of ninth graders in under-resourced high schools. These workshops build a young person's ability to make healthy decisions, access critical resources, communicate about their health, and advocate for themselves and others.
And fully embody
our endless potential.
In our world.
In our world. I visit our school's health center.
I always use protection.
I understand consent is about communication.
And I ask for help when I'm struggling.
After receiving Peer Health Exchange, 87% of young people said it influenced them to seek help if they were experiencing poor mental health. 91% said it influenced their decision to ask for consent at each step if they choose to engage in sexual activity. 89% of students said it influenced their decision to use a condom, and 92% were influenced to advocate for their own health.
15,000 college students and 150,000 high schoolers
across the United States.
We are Peer Health Exchange.
And we're just getting started.
So what do you all think? Are you interested in being a health educator? And something just to like share, because I'm like relatively new to Peer Health Exchange, but something that's really exciting when I saw this video is that one of the young health educators from Peer Health Exchange, I think she's from the USC site, PHE really sets you up well in terms of just like leadership options, but also being able to get connected to community health resources, whether that's knowing about community health centers in your community. And it's really cool because I didn't realize that one of the young health educators was a part of Peer Health Exchange until I saw this video, because I actually met her through an organization I used to work at called Black Women for Wellness, and now she's a program coordinator there. And I'm like, wow, just seeing that she was a part of Peer Health Exchange and now where she's at now, and just the steps you can do to really be involved with your community. And PHE can be like a stepping stone for that, to get you to connected to different resources and actions. So yeah, Peer Health Exchange is really cool.
Awesome. Wait, hold on. Sorry, I wanted to show Chrissy's email. But yeah, so thank you everyone for listening to our presentation. I am about to, so yeah, I'm gonna put Chrissy's email up on the screen so you guys can know. I don't know what, but yeah, so we're welcoming any questions. That is our presentation, but if you guys have any questions about the curriculum and anything that you saw today or what we do or how we're growing, we're happy to answer those questions now in a little bit of time that we have left. And again, I can connect with Bonner and Allie to see like how we can send out this presentation and make sure that you all have the correct contact information for us.
I have a question.
Mm-hmm.
So, being a person who works in the Bible Belt, how do you guys go about like starting programs at school, and like what kind of pushback do you get? Like, how do you kind of like earn that trust in schools that might be a little less trusting or be worrying about, what are the parents going to say and things like that?
That is a very great question, because that was actually the first question I got when I got hired for this position, because at the time we hadn't gotten into Dallas yet. We were mostly in the Northeast and on the West Coast. So what can happen and what we've been doing is first we look at state policy and make sure that the health educators that we bring in and the discussions that we have, like there's no way to leave out homosexuality out of our curriculum. Like that is something that we believe is normal, and everyone has a right to their own sexuality and sexual expression and gender identity and all of that. So we want to make sure that our health educators are safe. But something that we do, especially since there are more explicit laws regarding sex education, is sometimes we start a partnership small. So there are different versions of our curriculum. So there is like a 7-workshop version of our curriculum that only talks about substance abuse, and because we usually find that most schools are saying like, oh, we refuse to talk about this. We're like, oh, well, what are you doing as regards to substance abuse? And usually they aren't saying, they say, oh, nothing. So we're like, oh, here's a 7-workshop curriculum, let's see how it works. And sometimes we're able to add on the other workshops in subsequent years when schools see what our program and the model is before. So we want to make sure that we can start those partnerships, but it is hard when in conservative states and districts.
Hi, I have a question about summer opportunities. So one, do you have summer opportunities since school typically isn't in session? And two, what does that look like if you do have?
So summer opportunities generally isn't something that Peer Health Exchange has done in the past, but it's actually something that we're looking into right now, in terms of like health educators being able to offer like virtual workshops or like mini sessions. Something that our like design development team is working on right now is like a mental health focused summer opportunity for high school students. And then there's also one that's really exciting, is like a health leadership program. So we're like in conversation, which is I think one of the greatest things about Peer Health Exchange's work is working collaboratively with the youth health educators that we have, especially in this moment, to think differently about how to reach and connect and build community. So yeah, if you're interested, I recommend just like reaching out to us. Most of those opportunities right now will be for people that have been trained in a part of Peer Health Exchange as a health educator. But if you have like a background or strong interest, or or you're like, oh, Peer Health Exchange actually exists at my school, I just never knew, we'd be more than happy to like talk about those opportunities with anyone that's interested. Including, I know I saw another question about, and Evan Joy is the queen of outreach, so I can also have her lead this question too. But can Peer Health Exchange chapters be started outside of major cities? And part of that question is yes, and I can have Evan Joy really talk about the outreach strategy, but something that helps with getting Peer Health Exchange at like cities and places we aren't in, such as the South, is with people reaching out to Peer Health Exchange to say, hey, this is something that I really would like to see in my community, or we're already like mobilizing about this. Peer Health Exchange feels like it could be a part of our mobilizing efforts, if it's specifically for like sexual or health education in general as a whole. So we love being in conversation with people to support. It's like one aspect of it.
And also, like, at least sometimes our strategy changes and shifts, and especially since, you know, we do live during a health pandemic, so more virtual workshops are going to be something that I can see only growing at Peer Health Exchange. But our strategy in the past has been, of course, we're always going to focus in Black and Brown communities. We try to really partner with communities that have at least 50% students of color, primarily Black and Latinx. We also try to partner with districts that have at least, you know, 50% of students qualifying for free or reduced lunch. So it doesn't have to be a major city, but it definitely, you know, we have to identify like high need, and mostly districts that are under-resourced and cannot afford to have a robust health curriculum, so we can try to meet their need there. And so yeah, that doesn't always look like a major city, but as long as there's a local college and you know, those metrics like the ones that I named, we're definitely looking to partner, because we just want to make sure that the health educators can actually get to the schools in the surrounding district. That's the biggest thing. Okay. Giving space for any more questions. And of course, you can always email us on Chrissy's email right here.
If nobody has real logistical questions, I'm really intrigued to know how receptive young students and your audience has been to some uncomfortable conversations. When you ask a question about what you would want to know at 14, I don't know because I don't know. Do you know what I mean? Mm-hmm. So I'm just wondering how receptive they've been.
Yeah, that was something that I asked too, and something that I needed to see for myself. So I did workshop visits to see like exactly what students' responses have been to our programming. And definitely it's hard to get those students to open up those first couple of days when the health educators are new and they're like, okay, so who are you, like, coming to my class? But by the end of the workshops, they're definitely opening up and ask questions. There's anonymous questions, like boxes that they can ask if they feel like they don't, you know, want to speak up and ask that question in front of all of their peers. But yeah, they've become, in all of our exit surveys that they found that they really like that it's someone who's younger teaching this curriculum. They like how it's someone who's not in their school all the time answering these questions. So it's not like, you know, if they ask a private question, they have to see that teacher in English class next period or something. Like, the health educators just come in and then they can leave, and, you know, they really care about this. And now Peer Health Exchange, we switched from a different format. So now those 2 health educators are with that same class throughout the 14-week curriculum. So they're able to build a network, build a connection. The health facilitators learn the class's name, so they're able to, you know, build that connection as well, and that co-respect. So we found that they were like extremely receptive to the college students. So to connect with a new college, first step would be to reach out to y'all. Yeah, so the first steps in getting Peer Health Exchange on campus would be to reach out to us, and we can send you more information that you can pass on to your Bonner program lead. So, but then we are more than happy. We are really hands-on in the implementation process. And I've had, you know, Zoom meetings with the student who's interested in bringing Peer Health Exchange. They brought that information to their Bonner service, the program lead, and then we had a 3-way conversation on Zoom talking about answering all the questions and what it looks like. And so once it's certified, we get the okay from the service program at your school. We help you and reach out to local school districts. So we have someone who on our team who's calling schools, who's reaching out to superintendents and and nurses and anyone who's a decision maker at the local school district to help to also pitch Peer Health Exchange to them and see if there's a need there. So we do a lot of that hard legwork. The only legwork that we really ask to happen on part of the students also is helping like recruitment and talking to your friends and seeing who else wants to join in the Bonner program who's interested in doing this type of service and service site. But yeah, we do a lot of we have materials, we have 1-pagers, we have t-shirts and flyers and branded everything to help, you know, publicize on campus. But we definitely do a lot of that hard lead work in getting the local schools on board. And we're more than happy to talk to anyone at the college to help get Peer Health Exchange certified as a Bonner site. Chrissy, do you want to add to the implementation piece at all?
Yeah, Evan Joy really spoke to most of it. If we can connect with students, that's sometimes like makes Amanda, who's also my colleague, very excited, because we want it to be a very student-centered and driven initiative. It also does really help to have an adult ally, advocate, college just staff member as well, just so that there can be institutional support within your college. Bonner sounds like an amazing program already, which is a great start. But if you happen to be or know someone that you're going to share this information about PHE with, like a friend of yours that isn't a Bonner scholar or part of the Bonner program, that's another key thing we also look for, just because as we're growing to many different sites, Amanda and we are there to support folks, but we can't always be on the ground as well. So it does help to have a college staff member that's also very knowledgeable about the program and also able to advocate alongside us PHE staff as well.
Also helps with local expertise too, since like, you know, we're not in the community at all of your colleges and states and towns. So we'd like to know as much as we can about the district before we just, you know, we'd never want to steamroll into a district. We want to identify need first and good potential partners.
If there are no more questions, I do want to say thank you so much for sharing, just because as a person of color, it's so powerful to see a video of kids of color kind of reclaiming that piece of this is what happens in our communities. And I wish I would have seen that growing up for sure.
Definitely, I definitely feel the exact same way. Well, I want to thank you all. Oh, sorry, did someone ask a question? Sorry.
Well, that was just me. I was just gonna say, I volunteered for Peer Health Exchange when I was a senior at Occidental College close to 10 years ago. And it's been amazing coming back to the organization and seeing how much the curriculum has grown, because it really does center Black and Brown youth, and also people of varying identities as well, including trans, gender nonconforming. So you see that in our curriculum, and it's just truly beautiful to come back to and see that growth. So it really does mean a lot. So I love your comment, Ali, a lot. It means a lot.
And thank you all for joining and taking the time to listen today from your homes virtually. And thank you for bearing with us through our technical difficulties. But yes, thank you all so much for participating and definitely sharing what you wish you had in 9th grade too. It's hard to think about because, you know, we're still learning and growing now, but there's definitely I love how you guys were able to identify a lot of things that you wish that could have affirmed you as a person. And you would love to give back to 9th graders today.
So if there are no further questions, then I will say feel free to stay on and ask anything, but there is another session at 1, so be mindful of that and reach out to these wonderful people, because this was just, I'm so grateful to get to be here and experience it.
I would like to ask a question. I know that I go to college in a region that does teach abstinence only, and because of the region I live in, a lot of youth from the region that I'm in will go to my college because they get a lot of scholarships, and it's easy for them to still be able to go and not have to leave their families. And so I do find that, especially in our Bonner program and just in different ways that I've seen some of my classes, there's gross misunderstanding of some certain sexual health questions. And I know that, I don't know if we could do something like this for college students, but I know that I could hold a workshop or in my Bonner program to educate some of my peers. Is there any resources that you could kind of give for me so that I can take this into my college? Because there's so much, I mean, I had a friend who literally didn't even know like the first thing about periods, and there's so much confusion on consent and what it looks like and just different things like that. And so I would just like to be able to educate not only the youth in my county, but also the people that are coming into college with me. So are there resources that I could look into, or is there a condensed version of this somewhere that I could do with my college that you guys are doing?
Thanks for asking that, and I definitely understand because that happens a lot. That's actually why I got into this work. Freshman year of college, I got there and I heard some crazy rumors, girls who came into college saying they're like, oh yeah, like this guy told me and I believe that you can't get pregnant on your first time, or like, you know, things like that. And so
yeah, my friend thought you could only get pregnant one day of the month. I was like, that's not true.
Yeah. There's some definitely key gaps in understanding, and I realized that I had a really big privilege in the health education that I received. But unfortunately right now, Peer Health Exchange's curriculum is targeted for college students to teach it to high school students. But I do know that with that other Bonner students at Wagner College, in order to make that Bonner hour curriculum requirement, they have led workshops to their campuses, but that is something that was like a part of Peer Health Exchange. There were they did something like they had the experiences of doing it in classroom, but they really created their own type of programming to teach to their college. It was based on some of the curriculum and stuff, but there isn't really a shortened version of the curriculum that I could give to you. I could send you actually workshop summaries and what like each workshop talks about. I could do that with you today. If you just want to like put your email in the chat, I could do that right now and just send you the workshop. Summaries are just like subjects. So then even if it wasn't fully, you know, expound upon, it's something that you can definitely build on. Yeah.
Yeah, that would be really great, just because I just want to be able to educate the people that are in college with me that are making, I just want them to know that they have more choices than they think that they have, and they have safer choices. And I just want them to know that that I just want to help them, because I feel like even myself and a lot of my peers are so undereducated, just because of the high schools that we were in, and just being taught, like, we watched a birthing video and that was about it. So I just want to help people learn around me. So that would be really beneficial if you could send me that. I'd really appreciate it.
Of course. I know this is a little personal plug, but I actually have my own sex education Instagram page that you're free to follow, and it's pretty sex positive and definitely like non-heteronormative, and we go there. So I'll write it in here. It's called The Sexual Intellectual, and that's what I do in my free time. But that's something, because like peer health exchange, like we were talking about in this presentation, is sometimes it's hard to, you know, give our full comprehensive health education curriculum and sell that to local school districts, because of course they are, you know, sometimes more conservative. They believe in abstinence only and nothing other than that. So it is kind of hard to break down those barriers, but I would definitely try to I'll send you the workshop descriptions just to, you know, get some ideas, but I list resources on my Instagram page for people to talk to. I definitely I would recommend following other Instagram pages that give really like sex positive content. Planned Parenthood is great. They talk about a lot of non-heteronormative sex, and, you know, I learn things from them all day. But yeah, I would definitely, it's hard because in college, I actually wrote my senior thesis on that colleges should have a sex education course as a part of freshman year curriculum, because a lot of college students are arriving with different levels of knowledge about sexuality and have never even like discussed consent before. So I completely feel you. Unfortunately, it's hard to shop a really like sex positive sex curriculum to a lot of different districts, but hopefully, you know, I just have to recommend like really like taking the time and looking it up and following really interesting people on Instagram and social media, because they do share a lot of good content all the time.
Thank you so much.
No problem. Well, feel free to follow me. I talk about stuff all the time. And another thing, my college had a SHAPE. I don't know, they're like student, like public health educators. There are different college programs that are actually designed for college to be like, you know, get trained as a college near peer health educator to educate other college students. So you can also get like a SHAPE chapter started on your college.
Thank you so much. I really appreciate you and all that you guys are doing.
Oh, thank you for joining and asking questions. I very much appreciate you too. This was great. It was a highlight of my day. And thanks, Bonner, for facilitating this. Bonner, I wasn't in Bonner when I was in college, but I shared a dorm with them, and they were great. They were very serious. They had like chants and handshakes and t-shirts. Yeah, Spelman Bonners. Yeah, Spelman Bonners are really serious.
I think I will encourage, now that my watch says 12:55, I do need to start another session.
Yeah.
But again, thank you so much. Followed your I love it already. I was scrolling through.
Thank you. Thank you so much. Thank you for helping facilitate this and answering my questions at the last hour and email. And I really appreciate it. And yeah, I love Bonner, and I'm thank you for, facilitating this workshop with me. Thank you.
Absolutely. We'll be reaching out to you soon as well.
Okay, yeah, because I have to share the slides and stuff.
Absolutely. Thank you so much. Have a great day.
Thanks, you too. Bye.